Okay, here we go. This is your heart. These are your lungs. To see the pulmonary artery, remember it's going to be deoxygenated blood, is right here. It's going in. The pulmonary veins are going to be right here, but we'll go back to the veins later. As you can see here, you have the aorta coming out of the heart, the aortic arch. Here is the brachiocephalic. The brachiocephalic breaks into the left common carotid, which goes up to over here, and on the right side, hard to see, it breaks into the right common carotid. That was the left common carotid. It's the right common carotid, and the subclavian, and the right subclavian. The other branch of the aorta is the left subclavian. The left subclavian then branches into the axillary. It's a little hard to see. If you see, we're going to follow this path. It's going to go over here to about the armpit. Around here it would be considered the axillary. We're going to follow it. Axillary, and then as we get down more towards more into the arm, it will become the brachial. Okay, so then we have the aorta. It's going to run down, as you can see, after it arches and has the two branches up. It's going to run down. The first one we're going to see, the first major branch we're going to see is, remember, this is the thoracic aorta because it's by the rib cage and the heart and the lungs. This is going to be your celiac branch. It will branch to the hepatic. It will branch to the hepatic, to go up more, and to the left. And the splenic is this one. So we have the celiac that branches up to the hepatic, and this would be the left gastric, and this would be your splenic. Your superior mesenteric would be if we just go a little bit more down, and then if you see the next branch, that would be your superior mesenteric. We know that because it connects to the mesentery. Remember that spider web. Then next we would have, as you keep going down, and we would hit the adrenal, which on mine you can't really see, but you can see this little blood vessel right there. That would be your adrenal. In humans, the adrenal glands are on top of the kidneys. In cats, they are not. Then, after we get the adrenal artery, we would have the adrenal vein. Adrenal artery. We would have the renal artery after the adrenal artery. It'd be right there. Again, a branch off the aorta. The next, we would keep going down. Remember, follow with your finger. We keep going down the aorta. Eventually, we get to this funky looking area right here. It looks like a bit of a triangle. We're going to break down. These two sides are your external iliacs. This middle one, that little piece right there, before it splits, that's your internal iliac. And then with the internal iliac, if you can see, there's about two branches that come off. One goes into the bladder, one becomes the umbilical artery. That one in the middle, sort of going down, that is going to be your median sacral or caudal artery. Now if we go back to our external iliac and we follow that down, we will then branch off into the femoral, which would be right over here. And that will be all for the arteries.